epididymis, spermatic cord, seminal vesicles, and prostate gland, prostata. Testis. That is the testis. It has extremities superior and inferior, anterior border and posterior border, and two surfaces, medial and lateral. Behind of testis we have epididymis. Greek name of testis, that is didymis or orchis. That is epididymis, that is something what is behind of testis. Epididymis, behind and above of testis. That is epididymis. And epididymis has head, body, and tail. Testis, external coat of testis, that is connective tissue, it has name tunica albuginea, and this tunica albuginea separates testis into 300 lobules, small lobules inside of testis, and each lobule has convoluted seminiferi tubules, tubuli seminiferi contorti, that is place where spermatozoid produced. And these convoluted tubules continues into straight tubules, tubuli seminiferi recti. Tubuli seminiferi contorti, number 1, continues into tubuli seminiferi recti, number 2. It is lobuli testis, that is lobuli testis. Straight tubules goes to the network of testis, rete testis, it is rete testis, number 4, rete testis. And from rete testis, ductuli efferentes goes to the head of epididymis, number 5, ductuli efferentes. And these ducts in head of epididymis makes duct ductus epididymidis, number 6, ductus epididymidis. And this duct from tail of epididymis continues into deferens duct, ductus deferens or vas deferens, you're right, ductus deferens or vas deferens. This deferens duct pass behind of testis in scrotum, then continues into spermatic cord, pass through inguinal canal, and goes to the true pelvis. It is, that is urinary bladder. It continues into urethra. It is, what is it? Prostate gland. And it is seminal vesicle, vesiculi seminalis, and excretory duct of seminal vesicle, ductus excretorius, and deferens duct. Terminal end of deferens duct has dilation, ampule, ampulla ductus deferentis, joined with excretory duct of seminal vesicle, and forms ejaculatory duct, ductus ejaculatorius, pass through prostate gland and opens into urethra. That is ejaculatory duct. Number 6, that is ductus epididymidis. Number 7, that is deferens duct, ductus deferens. And this duct has 4 departments. In your book, first part of deferens duct, that is pars testicularis, because it is behind of sternum, letter A, pars testicularis, but new international name of this part, that is pars scrotalis, because it is in scrotum. As you want. If you will answer pars testicularis, that is correct, but it is old name. New name, and it is international name, pars scrotalis, in scrotum. Next part, that is pars funicularis, because it is in spermatic cord. Latin name of spermatic cord, that is funiculus spermaticus. That is why letter B, pars funicularis. Next, in inguinal canal, help me, pars inguinalis. And last, terminal part in true pelvis, that is pars pelvina, letter D. And pars pelvina makes ampule. I put here number 8, ampulla ductus deferentis, widest part of deferent duct. Number 9, that is seminal vesicle. Number 10, that is excretory duct, ductus excretorius. Number 11, it is ejaculatory duct, ductus ejaculatorius, and it opens into male urethra. Number 12, urethra. 13, that is urinary bladder. 14, that is prostate gland, and 15, that we already said, that is urethra. Well, that is diagram of pathway of seminal fluid. Spermatozoid is produced in convoluted tubule, goes to straight tubule, rete testis, ductuli excretorii, ductus epididymidis, ductus deferens, ductus ejaculatorius, and go away from male urethra. That is this diagram you need to draw next time. Now, what else? Maybe you know that testes start to develop in abdominal cavity and then descend into the scrotum. And wait 1 minute. Okay, it is anterior abdominal wall, that is anterior abdominal wall. External coat, that is skin. What is under the skin? Subcutaneous fat. What is below from the fat? Next coat. That is external fascia. What is behind of fascia? Muscles of anterior abdominal wall. What is below of muscles? Subperitoneal fascia. And last coat of anterior abdominal wall? Peritoneum. Is it clear? And look here, that is skin of anterior abdominal wall, and this skin together with testes surround testes and forms skin of the scrotum and continues to the skin of perineum. Clear it is. That is anterior abdominal wall, and here it is scrotum, skin of the scrotum, and here it is testes. That is testis together with epididymis. That is, here it is number 1, skin of anterior abdominal wall, and here it is number 1, skin of the scrotum. Behind the skin, under the skin, on anterior abdominal wall, we already said subcutaneous fat. And this subcutaneous fat in scrotum continues into fat tissue reduced in scrotum, but here it is present connective tissue with smooth muscles. Connective tissue and smooth muscles under the skin of the scrotum. And name of this coat is tunica dartas. Tunica dartas. It is connective tissue and smooth muscles in tunica dartas. And on anterior abdominal wall, that is subcutaneous fat. Clear? Next, what is under the fat? Superficial abdominal fascia, fascia abdominalis superficialis. And this fascia continues into fascia spermatica externa, external spermatic fascia, fascia spermatica externa, here. That is why in abdominal wall, that is superficial abdominal fascia, and in scrotum it is fascia spermatica externa. Next, in the region of superficial inguinal ring, look here, that is, here it is testis, that is spermatic cord, and spermatic cord goes to superficial inguinal ring. And here it is fibers of abdominal wall makes here fascia intercruralis in the region of superficial inguinal ring, and this fascia continues into fascia cremasterica. Here it is, we have fascia intercruralis, number 4, and this fascia continues into fascia cremasterica in scrotum. Number 4, fascia cremasterica. Next, here it is muscles of anterior abdominal wall, muscles of anterior abdominal wall. And last muscle, most internal muscle, who remember what is the name? On anterior abdominal wall, that is musculus transversus abdominis. And this muscle continues to scrotum as musculus cremaster, cremaster muscle. That is, next code, musculus cremaster. Here it is number 5, that is musculus transversus abdominis, and in scrotum it is musculus cremaster. Behind of transversus abdominal muscle, we have fascia transversalis. It is part of subperitoneal fascia, fascia transversalis. And this fascia continues into internal spermatic fascia, fascia spermatica interna. Number 6, that is fascia transversalis. And number 6 in scrotum, fascia spermatica interna. And last code, that is peritoneum. And in time of descendance of testes, peritoneum makes blind process. Name of this process is processus vaginalis, that is in fetus. This process, processus vaginalis, in time of descendance of testes, this process separates from peritoneal cavity, and here it is, it's disappear. That is why this last code of the testes, last code, number 7, that is tunica vaginalis testis. In time of development of fetus, it is processus vaginalis. But after descendance of testis into the scrotum, it is tunica vaginalis testis. And this tunica vaginalis consists of parietal layer, letter A, and visceral layer, letter B. It is clear? And space between them, that is cavum vaginalis testis. That is a cavitas between parietal and visceral layer. If this process not separates from peritoneum, and in this case we will have communication between abdominal cavity and cavitas in processus vaginalis. In this case we receive hernia. In this case, intestine can descend into the scrotum because we have communication between abdominal cavity and tunica vaginalis testis. But in normal, tunica vaginalis or processus vaginalis separates from peritoneum, and in this case, only peritoneum surrounds testis and makes tunica vaginalis testis. Clear? Next, that is last code, peritoneum, number 7, continues into tunica vaginalis with parietal and visceral layer. You not need to draw this diagram next time, not necessary to draw, but you need to answer which layer of anterior abdominal wall continues into which code of the scrotum or testis, codes of the testis, clear? Okay. What else? Some words about prostate gland. If we cut in horizontal plane, we will see that urethra pass near of anterior surface of prostate gland. Here it is anterior surface, here it is posterior surface, and urethra not in center but near of anterior surface, and ejaculatory ducts pass behind of urethra. That is ejaculatory duct on the left and on the right side. In this case we have left lobe, lobus sinister, right lobe, lobus dexter, and middle lobe, lobus medius. And isthmus of prostate gland, that is narrow part of prostate gland in front, in space between urethra and anterior surface of prostate gland, that is isthmus. Here it is, isthmus of prostate gland. Left, right lobe, middle lobe, lobus medius, and isthmus of prostate gland. Male urethra on posterior wall has eminence, that is colliculus seminalis. Colliculus seminalis, it is on posterior wall of prostate gland in urethra. And near of apex of this colliculus seminalis, ejaculatory ducts opens into urethra. And look here, that is prostatic part of male urethra, that is colliculus seminalis. Here it is openings of ejaculatory ducts near the apex of colliculus seminalis. Near of it we have numerous openings of prostatic glandules. Glandula prostatica opens into urethra near of colliculus seminalis. And at the apex we have blind fossa on the apex of colliculus seminalis. It has name utriculus prostaticus, that is male uterus, small fossa